Now, as a disclaimer, I'm going to say that I'm not a fan of the word tension headaches. I think that tension headache a lot of times is a misdiagnosis. And in my experience, a lot of patients who are labeled as tension headaches are cervicogenic headaches coming from the neck. And the remaining patients who are labeled as tension headaches are actually migraine patients. So I'm not a big fan of that tension headache label. So I'm going to use it interchangeably with cervicogenic headaches. And the idea behind it is that depending on the cause, which a lot of times could be as simple as stress, a lot of times people carry stress around their shoulder muscles and their traps and their neck. And basically, when that happens, or because of ergonomics, or if somebody has had a history of a concussion or whiplash in the past, or even neck surgery, any of those will lead to spasm and stiffening of the muscles of the neck. And when that happens over time, that will lead to irritation of the nerve that you see in yellow right here called the occipital nerve that's trying to pass in between those muscles. And that's what leads to a lot of those headaches. Now, that nerve has more than one branch. You have the greater occipital nerve that you see in yellow right here, and that one goes from the back of the head all the way here, and then it leads to also deferred pain behind the eyes, what we call retroorbital pain. And then you also have the lesser occipital nerve, which goes more toward the temple and the ear. So people can get temple pain from that as well. Tension headaches or cervicogenic headaches tend to be on both sides, but they could sometimes be only on one side. They tend to affect the occipital part of the head as well as the frontal part sometimes, retroorbital space, so behind the eyes, the temples. So unlike migraines, which we said were throbbing and pulsating, cervicogenic and tension headaches tend to be more of a dull ache, more of a pressure sensation like a tight band that people describe around their head. The duration of these headaches can be anywhere from hours to days or even weeks. A lot of my patients tell me that they essentially feel they have a headache every day. It's just it goes up and down and it's on and off. Now, the treatment for these headaches, whether we're calling them tension headaches or we're calling them cervicogenic headaches, is different from migraine treatments. They tend to be less severe than migraines, and the mild ones will respond to over-the-counter medications like Tylenol and ibuprofen or other NSAIDs. However, sometimes a nerve medication can be added, such as gabapentin or Lyrica, and muscle relaxants can sometimes help loosen up the muscles of the head and neck too. Some practitioners like to use amitriptyline and other tricyclic antidepressants for the tension headaches that are more similar to the migraines. From a procedural standpoint, occipital nerve blocks are an excellent strategy for these headaches, because basically you would be decreasing the inflammation around the occipital nerve that is the root cause of these headaches. More severe cases of cervicogenic headaches can be due to facet arthritis in the cervical spine, and those would require more involved procedures like cervical medial branch blocks and radiofrequency ablation in the cervical spine. But then when it gets to that point, I wouldn't really call them primary headaches anymore.